Amplitude variation in the single fiber signals. In the single fiber recording, we always aim for clean signals, fulfilling the criterion for a single fiber action potential, namely rapidly rising phase, a short rise time, and above all, constant shape and consecutive discharges. The latter may be difficult to ascertain, since even a movement of 100 micron will change the amplitude by 20 or 30% or even more. Such small movements may come from the electromyographer or from the patient in their small movements, even breathing, and may be the heart pulse. Often the stability is quite amazing, and one can keep a constant position for quite a while. There is, however, a small variation, in this example best seen in second potential, but the signals are parallel and do not show other irregularities. This is a recording from extensor digitorum, and the jitter is 75 microseconds. We can see the signals live in this video. Here is an example of an uncommon situation where there is an amplitude reduction in both the first and the second potential at just one discharge, so a minor movement is suspected. Here is one discharge, and here we superimpose to the next discharge, and thus you see the higher amplitude in both signals, particularly in the second. And when we superimpose 5 signals, you see how the other 4 more or less have the same amplitude. But there is another cause to amplitude variability, and this is disturbing activity from other motor units that appear randomly in relation to the triggering one. Here are some examples. In this slide you see 3 traces with activity from other motor units, and here you see just one such situation. Listen to the activity in the background in this video. Small potentials that do not trigger the sweep but occur randomly along the trace can be detected. We use a slightly lower gain than in previous clip. If the artifact occurs outside the action potential under study, it doesn't matter much, but sometimes it coincides with the signal and can give this effect both on amplitude and even on the jitter. This is a common cause to minor fluctuations in amplitude. Here you see the fluctuation in baseline due to disturbing activity. The problem of superimposition is more pronounced in recordings with concentric needle electrode. In summary, the most common cause of amplitude variation is slight electrode movements and the superimposition of randomly occurring activity from other motor units.